Does testosterone replacement therapy cause prostate cancer?
Hi, I'm Stephanie Wolf, the leading sexual wellness expert here in Studio City, California at the Novus Center.
No, my friends, testosterone does not cause prostate cancer. Studies have shown that men who have aggressive prostate cancer actually have low testosterone. And the lower their testosterone, the more aggressive the prostate cancer tumor is. I want you to think about something. I often bring this up during my consultation. How many men in their teens and 20s who have high testosterone levels come down or have prostate cancer? It's a valid question and one to ponder. So why does testosterone not cause prostate cancer? Well, believe it or not, testosterone is responsible for maintaining the health of the prostate gland. It also reduces the enlargement as well as the inflammation of the prostate gland, otherwise known as BPH, benign prostatic hypertrophy. There are 3 explanations for why testosterone does not cause prostate cancer. The first one is that testosterone actually improves the muscular capsule that surrounds the prostate gland, keeping it healthy and toned. Number 2, testosterone is responsible for making 2 active metabolites, dihydrotestosterone as well as estradiol. Both of these are needed for a healthy prostate gland. Specifically, dihydrotestosterone activates the prostate gland cells, and these cells are responsible for secreting what's called food to nourish the sperm. So if you don't have enough dihydrotestosterone, then you're not going to allow this nourishment to happen and you're not going to have healthy sperm. What appears to be an issue has to do with estradiol, or the overconversion of estradiol from testosterone. I'm going to get a little bit more specific and detailed, so bear with me. Research has shown that estrogen plays an important role in the prostate health, just like dihydrotestosterone and just like testosterone. But there are 3 metabolic pathways that are responsible for breaking down this estrogen, 2 of which are cancer causing, and 1 pathway is non-cancer causing. It's the good estrogen, the one that you need for healthy bones, healthy brain, and healthy prostate gland. So let's talk about that. Testosterone will be converted using the aromatase enzyme into estradiol. What really matters is what happens afterwards when your body is trying to break down this estradiol. The 2 pathways that are bad estrogen metabolizers are actually pro-cancer and pro-inflammation. So the goal is to convert this estradiol into the good estradiol. And as we've said, the good estradiol is responsible for healthy bones, brain, and prostate gland. This is going to be anti-proliferative and anti-inflammatory, protecting you from prostate cancer. It's also important to understand that we have 2 different types of estrogen receptors on the prostate gland specifically. They are called alpha and beta. Alpha is what we consider pro-cancer, pro-inflammation. This is what is going to enhance prostate cancer, whereas beta is actually the good receptor. This is the one that's going to reduce your inflammation as well as reduce the ability to proliferate into prostate cancer. These receptors, both alpha and beta, is how your prostate gland actually responds to the estrogen. So it's very important that we are using the correct receptors. If you have low testosterone, you will naturally move the testosterone from the good receptor, which is the beta receptor, onto the alpha receptor, which is the bad receptor. So it's very important that we maintain a healthy testosterone level so that we can be sure to activate the beta receptor, the one that's going to protect the prostate gland. So what can you do to ensure that your prostate gland remains healthy? Well, it's easy. Get your testosterone level checked. Let's make sure that you have adequate amount of testosterone. The second thing that I like to do at the office is making sure that I'm checking both your estradiol and your dihydrotestosterone levels. Remember, the amount of testosterone that you're making or you're injecting or you're applying will convert into these two active metabolites, dihydrotestosterone and estradiol. So you want to make sure that you're looking at all three of these levels. The last thing that you want to do is you want to make sure that you're metabolizing this estradiol into the good pathway. Remember, I said there are 3 different pathways for estrogen metabolism, 2 of which are cancer-ridden. These are the ones that cause inflammation, and they're going to proliferate cancer cells, making them more aggressive. So we want to make sure that we're pushing the estradiol down the correct pathway, which is the good pathway, the anti-inflammatory pathway. One of the ways you can do this is by implementing phytoestrogens into your diet. This is going to consist of alfalfa or legumes, maybe even soybeans or chickpeas. So thus consuming more phytoestrogens is going to ensure that you're activating more of the beta receptor. This is what's actually going to attract the good estrogen. So if you're wondering what your testosterone levels look like, then give us a call here at the Novus Center.